Well, relaxation's part of Wellness Wednesday, but you know, we have Dr. Nick Testa here to talk to us about hot medical topics. He's the Chief Physician Executive at Dignity Health in Southern California. He's pretty much seen it all and done it all. First up, we're going to talk to you about a trend that's going on right now. We're going to put you to the test, and I know you love this. Clear plastic shoes like these. Kim Kardashian wears them. Our own Rita Garcia wears them. My children wear those jelly shoes. What is up with those shoes? Because they say they can cause stinky feet, odor, what? Give it to us.
So thank you for asking me this critical question, because this is where we need to go. So the condition that you get worried about with shoes like this is what's called hyperhidrosis. So adults get it. I have it right now, where your hands get sweaty and your feet get sweaty when you get nervous or when you get anxious. But when you put on a pair of plastic shoes, it really enhances that because they don't breathe. So you get sweaty, and then you get fungal infections, you get bacterial infections, and it just gets a little bit stinky and gross down there.
Well, it's not to mention they get blisters. You know, there's studies out that say, that, like you said, bacterial infections, fungal conditions, and stinky feet. But are they safe?
I think they're safe for short amounts of time. I don't think we want to live in them. But I think if you're making a fashion statement and you're putting it on for a night, I think they're totally safe. If we're wearing them every day, I think it's going to be more of a problem.
And the same applied to jelly shoes. You know, those cute little cheap jelly shoes we buy for kids. Summertime, they're easy to put on. I'm a parent. I think they're cute. I actually thought these were not bad for you, but just don't keep them around. They're
good for short periods of time. Those things are meant actually to be disposed of after several months. So don't keep your kids in them for summer after summer after summer.
Well, if you smell something, chuck them.
Yeah, probably time to go.
Okay, now let's get back to college. You know, have you seen this ad, doctor? Take a look at this ad for kids going off to college.
Over the last 24 hours, you've finished preparing him for college. In 24 hours, you'll send him off thinking you've done everything for his well-being. But meningitis B progresses quickly and can be fatal, sometimes within 24 hours. While meningitis B is uncommon, about 1 in 10 infected will die. Like millions of others, your team may not be.
First of all, it really gave us a lot of pause in the newsroom. Our producer who's doing this segment has a son who's going off to college. Meningitis, kids are on their own for the first time, taking care of your health. What should we tell our kids who are going off to college to know the warning signs of meningitis?
Yeah, so let's talk about meningitis first. And I have seen that video, and it's correct. 1 in 10 people can die when they contract meningitis. So signs of meningitis, it kind of comes in two forms. One is sepsis, which is the systemic, which starts out like a cold or flu. The other one is the meningeal infection, the infection in the brain, which is a bad headache and neck pain. Comes on very quickly. The main thing we can do, though, is get our kids vaccinated before they go to college. So there is a meningococcal vaccine. Well,
how far in advance do you have to get that vaccination? Does it quickly go into the system? Do you need to do it months in advance? Is it a series of shots?
It's one shot. The CDC recommendation is to get the shot at 11 years old, which gives you plenty of time to ramp up. If you haven't gotten and your kid's going next week, still time to get it done before they go.
And so what should you tell your kid? They're in their dorm room. Mom, I have a headache. Would you say go to the student union if you don't feel well? Because most kids won't. They'll take an aspirin and go to bed.
So one of the things that every kid should do is know where the health services are on campus. Become familiar with that early on. This is all stuff you should be talking to your kid about before they go to school.
And you said there are 4 main vaccinations that kids should get, or men should get, or anyone should get.
Yeah.
So what are they?
So the CDC recommends 4 vaccines for the preteen, teen, and pre-college students. We talked about the meningococcal vaccine, which can be life-saving. Tetanus update. The other one is the flu vaccine, right? So I get my kids the flu vaccine, but when they go off to college, it's their responsibility, right? That season starts in October. But the last one is the HPV. Right, which is the human papillomavirus vaccine, which can prevent numerous kinds of cancer, particularly cervical cancer.
But don't they have to get that if they're before they're sexually active?
The recommendation is to get it before they are sexually active.
Is it too late to get it afterwards?
They generally don't recommend it after 25, but the main thing is to get it before you contract the disease.
And quick. Kids going off to college, binge drinking. What are your, what are your recommendations to help monitor? They're on their own.
Yeah, they're on their own. So, we started the segment talking about the meningitis, right? 1 in 10 can die. But there were only 375 cases of meningitis in the United States last year. There were 1,875 deaths related to alcohol on college campuses, and there is no vaccine for that. The only thing we can do is before our kids go off to college is talk to them. As parents, it is super difficult to have those real conversations about drugs, about alcohol, and about sex. If you haven't done it yet, you need to start that conversation now, because they need to be able to come to talk to you and ask you questions and explore those concerns with you before they find themselves on campus with a bunch of peer pressure and a bunch of new stuff going on.
You know, my mom always used to say to me, too, she got to know my friends, especially in college.
Yeah.
Get your friends to know your parents' number just in case there's an emergency.
Absolutely.
Don't be afraid to call.
Yeah,
and get help.
It starts when they're young, too. Get to know their friends. Get to know who they're hanging out with. Your vibe attracts your tribe, you know.
Your vibe attracts your tribe. Dr. Testa. That's a great one to end up. You know, National Relaxation Day. Go get yourself a massage. You deserved it.
Thank you
You did
so
a great
much,
job
Megan.
on today's segment. All right, coming up.